All of this in the round. Let's talk about the NHS, because the monthly statistics are being released and they show the impact of the heat and then the impact it's having on the health service. A&E demand hit a record high in July as the NHS faced a summer surge amid 2 heat waves. 3 busiest months ever recorded have all come between May and July of this year. It was England's busiest July on record, with 2.49 million patients in attendance at A&E. That's 80,244 patients per day. However, it's not as high as June, when 81,263 patients attended A&E per day. That's the busiest month on record. Well, reacting to those figures was the Health Secretary, Yvette Cooper.
Well, what we've seen is waiting times, waiting lists coming down again. Waiting lists are down 350,000 since the election as the result of the investment that the Labour government's put in, but also, crucially, the phenomenal work of NHS staff. And they've been increasing the number of treatments, patients seen, at the same time as also dealing with the heat, and the number of people arriving at A&E also reaching record levels. So we really should thank our NHS staff making sure that NHS is always there for us.
The Royal College of Nursing says that staff are collapsing in extreme heat, that conditions are not fit for humans. What will you deliver, what will you do to improve conditions immediately and for future summers?
Well, the heat is impacting on our health and also on our NHS. We've seen record numbers of people coming to A&E in July, and also it's impacting on conditions for staff in many of our really older hospitals as well. So that's why we're also putting £6.7 billion into the capital improvements, the repairs, and that includes new cooling systems across our NHS, and also working to support our NHS staff who have managed to increase the treatments, increase the numbers of patients being seen at the same time as seeing this increased demand. It's that partnership working across our NHS and backed by the government that really is keeping that support in place for patients.